This is Long COVID Foundation podcast. My name is Dr. Valentina Veduta, and I am Long COVID Foundation trustee. Thanks for joining us today. We're gonna have a discussion on new coronavirus strain that is highly infectious and highly spreadable across UK at the moment. What we see is people are often concerned whether it is more deadly. We invited Professor Ancha Baranova to help us understand this new variant of coronavirus that is spreading across UK. So please welcome Ancha to our podcast back again. We have a couple of questions to you to help us understand, first of all, whether this virus is more infectious as the previous type of coronavirus.
Hello, Valentina. Very glad to see you again. Well, first of all, what I should say, that is new virus. It is the same old coronavirus, SARS-CoV-2, but it's new version of the old coronavirus. And of course, the scientists are concerned not about nothing. This is important that the infectivity of this virus is higher than in the previous versions of the same virus. But let me in detail discuss with you what changes in the virus may lead to increased infectivity and what other factors could contribute to larger infectivity. First of all, infectivity of the virus is found out from two different kinds of studies. Both of them were done in UK. One kind of study is simply epidemiological study, the tracing of the contacts and finding out how many people on average the person infected. With old version, say each person infected from 2 to 3 people, yes? And with the new version, say from 3 to 4 people. That is substantial difference which contributes to higher infectivity. But there is also a second factor to the same, also was evaluated in the laboratories in the United Kingdom. This is in vitro study when you have cell culture, which is permissive for this virus. You put certain finite amount of the virus particles into this cell culture, and you see how many viruses are generated from the cell culture at certain moments of time. You are doing like a growth curve. Mm-hmm. And if you compare growth curves from the new version of the virus and the old version of the virus, you will see that new version produces more viral particles per unit of time. So that is also contributing to the high infectivity. However, the first measure, the epidemiological one, and the second one, which is purely laboratory research in the cell culture, which is a model research, they really cannot be compared to each other. So this number, like 70% more infectious, it is somewhat arbitrary number. And if we bring it to the real life, the number could come from the following. The standard situation with the virus, with the old virus, was as such as somebody is getting virus on Monday, and then Monday, Tuesday, Wednesday, Thursday, feeling all right. And say on Friday, develop symptoms, headache, muscle ache, fever, person feels that there is a disease, right? So after this, person's doing decisions, do the testing, maybe wait it out a little bit. But at least by Friday, person is aware that something going wrong, okay? Now what's happening Thursday, where this person is feeling all right, is that the virus already spread to the level that the person is infectious, but unconscious of his or her infectivity, and going around. Mm-hmm. So during this Thursday, somebody can go see parents or come Christmas to work.
Christmas shopping. That's
Christmas shopping, yeah, something like this.
Yes.
Right. But person is having about 24 hours to meet other people and infect them. Mm-hmm. Now with the new virus, there could be two different situations or a mix of both. First situation is that the same thing, person gets sick on Monday, Tuesday, Wednesday, Thursday, Friday, person gets the symptoms. But he became infectious one day earlier and now having both Wednesday and Thursday in order to go around Christmas shopping, to school, to see other people. So 48 hours instead of 24 hours. We're simply doing more contacts through this larger period of time, and that's it. It's not due to virus, it's due to us.
Yes.
Another more milder situation, actually, that's a decrease in the pathogenicity of the virus. Not increase, but decrease. But instead of Friday, person would develop symptoms on Saturday or Sunday, right? So still start being infectious on Thursday, but feel all right for longer period of time, continue going out again longer time. So that is how virus getting more infective without any influence on pathogenicity, even with the decrease of pathogenicity, lighter disease getting spread more. This is actually the goal of the virus. Virus don't want to kill us. Virus just want to jump more from person to person, multiply more copies of itself, and that's it. Now, what is possible on top of this is that people who get infected with virus also produce larger amount of viral particles in the nasal cavity by coughing, by sneezing, spreading this virus more. This kind of comes from in vitro studies, because in vitro virus was growing faster, producing more viral particles. It might be that the same is happening within live people, but there are so far no proof that people who actually have this new variant of virus produce larger amount of viral particles. So I think that it's probably a mixture of both. Both extension of the infection period before symptoms and also extent of the production of the viral particles during this asymptomatic stage. When person is already sick with fever, at that moment person already almost not spreading, because everybody knows better than to walk into coronavirus patient room and start socializing, right?
Absolutely, yes. Yes.
So that's a very important thing. So we are achieving higher infectivity without aggravating the condition. People are not getting more severely sick. Now, I kind of can anticipate your next question. You will ask about those couple of papers which were published in UK, one of them, and then it was reprinted all over the world. I read it today as well, that children now are more susceptible to coronavirus than they were before.
Yes, yes. So please comment on this type, because we are quite stressed now what's going to happen with our schools opening again in January, because we are worried that our children are going to be more infectious to this variant of the virus.
Well, we are very concerned about that as well, about our own children. Right now I'm in the United States, our schools are closed and already closed for quite some time. I know that in the United States they're closed, but in UK they are open. And I know that every country treats it differently, but the elephant in the room is that children could be infected without showing any symptoms, and then they infecting each other, bring infection to their parents, and what's even more important, to their grandparents. And this is, of course, putting their own family in the danger without actually understanding what's going on, because we couldn't really blame children. We love children, right? What I think is happening, this is my opinion, which for now is not yet substantiated by some scientific papers with hardcore data. But I think what's happening is that children always were able to get coronavirus. And they got coronavirus during the first wave as well. And at that time, when we were not testing children, and we have not learned yet how exactly to distinguish symptoms of coronavirus from any other sickness. And, you know, children get sick often, and very often just a little sickness and then it passes. Coronavirus in children is just one-day diarrhea, nothing else. Certainly, they wouldn't grab their children and bring them to hospital in order to be checked, because that's the place where you actually get coronavirus. So a lot of cases of infection in children in the first wave, so-called first wave, just got unnoticed. What we are happening now is, again, the mix of two. One is that we have more tests. I know that UK is testing very rigorously and testing kids now, and they were not tested before, and that's why we have more diseases. And second, because children are passing the virus asymptomatically, very often their immunity to the virus is also fleeting. The virus could come second time and not seeing really neutralizing immunity, but some low-level immunity, just simply display visible signs on a second time, the signs which were not expected after the first wave. Again, a combination of things. First of all, even if children are so agile and full of life, but it is possible to deplete child immunity. So if child get coronavirus first time without any sickness, still, and I hear it from many sources, after coronavirus, even asymptomatic, certain stores in the body get depleted, like vitamin D level may drop after asymptomatic coronavirus. Some other vitamins may drop. Antioxidant ability of the blood also will drop. Easier for virus to come second time. And even if it's usually not causing the disease, but it's more visible. Instead of no disease, we see slight disease. And this is also possible. The lesson from this is that we need to really work on restoring health of everybody who was down with coronavirus, even if disease was asymptomatic or mild.